thought, maybe today's a good painting day, a good day for painting. I was with another healthcare organization, and I had gone to get my annual mammogram.
Mommy, how about pink inside it?
Oh, that's a great idea. Good job, sweetheart. They saw something alarming. They said, come back in 6 months. I did. They still saw something, and they said, come back again in 6 months. And I said, okay. Then the radiologist said, this is most likely not cancer. Let's just check it out and get a biopsy and, put this to rest. And then the next day, he was to call me to most likely assure me that it wasn't breast cancer. In fact, he said, well, we got your results back. And he said, and it turns out you do have cancer. It's invasive ductal carcinoma, low grade. I consider myself a very strong person, a very faithful person, ready to take on anything. And that rattled me. You need me to orange? What color should mommy do? Yay! Having breast cancer with a 3 to 5 year initially was terrifying. That hi, how are you doing, Mom? Their little lives might be interrupted in a negative way. But then I just said, nope, this is not my style, and so I'm going to be more driven than ever before to be cancer-free forever. We had some decisions to make. My twin sister had walked through me every step of the way, and she knew a lot more than I did about radiation oncology, having been a radiation oncology nurse. And she was really committed to having me get a second opinion. And that is when my journey of 100 steps took the most amazing turn. And I have chills just thinking about it.
So this is the MedStar Health Bel Air campus, and here we have the MedStar Georgetown Cancer Institute, our cancer center here. The affiliation gives me as a physician the ability to network with physicians who are doing cutting-edge research in breast cancer.
Melissa came to my office because she had been newly diagnosed with breast cancer. And when she came in, we were able to arrange what we call a multidisciplinary breast consultation. So on that day, she met with me for breast surgical options, since I'm a breast surgeon, but she also met with medical oncologists as well as radiation oncologists.
I was most impressed with how they were able to schedule all in one day. I really felt like I was their main priority in those meetings.
Everybody's cancer is different, plan could be different, and when all these physician minds come together and they talk about the patient, it comes up with a good composite plan. The patients, every time they walk in, this is the one thing that they say, they're just so happy that they don't have to go out of here. If I tell them, you are here, I need blood tests, I need your scanning, I need you to meet with this physician, it's all right in this building, and that makes life so much easier that would be the same thing I would want for myself.
I left that day knowing I was going to switch to MedStar Health because I just felt that they were the best possible team for me. I had my lumpectomy at Franklin Square with Dr. Okabe. I feel good. She prayed with me before our surgery, and that made a life-changing difference for me. It really did. I was able to go into that OR with total and complete peace of mind. We looked at the calendar, and I said, I'm going to celebrate my 46th birthday having my first chemo treatment, and this is the best thing I can do to ensure that I'm going to live it to the fullest and highest potential. And so my twin sister went with me. I met the nurses there, all of the nurses in the cancer center who help administer the chemo treatment. They are just like big sisters to me. The first time's scary because you don't know how your body's going to respond, and you don't know what side effects you might have and how that might impact not only you but your family. And so it can be a little bit unnerving. Dad. I knew that my children would have a response to my hair loss. The more my husband and I prepared ourselves, then we could then prepare our children, and we made it fun. It's just hair.
So Melissa is amazing. She brings in such a lot of energy, and it's not just within her, it touches everybody who's around her. And you know, whoever is sitting in the room with her can feel that energy.
My last day of chemo! It's beyond my wildest expectations for me to be living the life I'm living. I married my best friend. Who's my best girl? I adore my children, and I mean, life has its challenges, but I gladly take the challenges that I've been blessed with because I'm really doing well.
So Melissa has an early stage breast cancer.
All right, show me your hands, no tingling, no numbness,
She
nothing.
will be cured of this cancer. Over 90% of patients who have this cancer are cured.
MedStar Health in Bel Air is such a blessing for so many reasons.